My name is Steve Leslie, one of the consultant cardiologists here, and you've come here to the cath lab today to have a picture taken of your coronary artery. It's called a coronary angiogram. We do this procedure 1,200 times a year. It's very routine for us. It's obviously not routine for you, so we'll talk you through it and try and make it as relaxed as possible. If you have any questions or are uncomfortable during the procedure, please let me know. So the procedure is going to take around 10 to 15 minutes to take the pictures, and then I'll stop. We'll have a look at the pictures, I may discuss it with a colleague, and then we'll go ahead and offer you a balloon treatment and a stent. And that can take anywhere from 20 minutes to 2 hours, just depending on how long it takes. We don't rush these things, it's important it's done well. The most important thing about being in the cath lab is to be as relaxed as possible and to know that if you have questions, please ask them. We're here to make this take the stress away from you as much as possible, and we'd like you to enjoy the procedure. When you come into the cath lab, there'll be a number of staff and we have a number of personnel who are in the lab here for your safety. We will get you to come up and lie on the table. There'll be an X-ray radiographer at the end of the table who is moving the machine and the table. There will be 2 or 3 nurses and myself as the doctor doing the procedure. Once you are on the table and comfortable on the table, I'll then clean your wrist with some cold solution. We'll then cover up your wrist in with a sterile drape, and then insert the local anaesthetic, which will sting a little bit, and then it will go numb. Once the area is numb, I'll insert a small plastic tube called a sheath that will allow me access into the artery and allow me to get to the heart. The majority of our patients do not need any follow-up. We're not expecting any problems, so after the procedure today we would discharge you from our care, but we do have our cardiac rehabilitation nurses who will be in touch about 7 to 10 days with a telephone call, and then a few weeks after this with a face-to-face or telephone consultation, just to make sure you're doing okay and to make sure that any pains that you had have resolved and that you're on the right medication. Before coming into the cath lab, many people are very anxious, and the vast majority afterwards tell me they don't know what they were worried about, and we have several patients that may need to come back for repeat procedures, and the majority of people don't find that a problem at all. If you've had angina before you have your stent today, then there's an 80% chance that we will have cured your anginas, and that means that you'll be able to do the things that you want to do again, exercise in an unlimited fashion. It's important for the first 24 hours that you are careful with the wrist, but after that we would expect you back to a normal quality of life.